And one of the common causes of that in my practice has been a condition which a viewer had called in over break and asked us about. And her question was, I've been diagnosed with plantar fasciitis.
That's right.
Can you explain that to me and tell me how it's treated?
That's right. So plantar fasciitis takes us back to the heel pain on the bottom, and that structure, the plantar fascia, and fascia is basically what we call soft tissue within the body that has a certain role. And in your foot, you actually have what's called a fascia that runs from the bottom of the heel here to the ball of the foot.
So it's a tough material.
It's a tough material that basically works to where if you think like, I guess one way I try to explain it is if you think of the foot like a bow and arrow, and the bow part, the joints and the bones are like the wooden part of the bow, and this ligament is like the string of a bow, and the tension on that ligament is important for the structure of your arch. But for different reasons, that ligament at the base of the heel, sort of similar to what a spur is, can become inflamed and painful. So that is typically called plantar fasciitis. What a lot of people you'll hear in the past and still currently will say, oh, someone told me I have a heel spur, which people with plantar fasciitis or heel pain may have a heel spur and may not. A lot of times patients that I see
and they might be just as painful, correct?
They might just, and they can be as painful, and to where, and they're usually related to where, you know, a patient will be referred to our office because they had an x-ray showed a heel spur, but then they come in and we found out that the pain is not actually near the heel spur and it's elsewhere, and it was just a finding. So having a heel spur does not mean that you need to seek immediately treatment, but at least evaluation to make sure it's not causing the problem. But with the plantar fasciitis, it goes into the anti-inflammatories such as Motrin and Aleve. In the office, we can treat patients with other treatments such as cortisone injections, which do help patients get better sooner and get better to where they can return to their previous activity levels and return to work.
A very rapid improvement in
That's right.
discomfort. But you also have to wear, and not everybody prescribes it, I don't know what your pattern is. In my office, I'll prescribe a splint for nighttime.
That's right.
And nobody ever sent me a Christmas card for this splint, because you know you have to wear a splint that holds your foot up in a position like this all night long. So it goes on the bottom of your foot. Just Google or go on Amazon and Google plantar fasciitis splint, and you'll see something. So it's a 90-degree splint that you wear in the evening, and your significant other doesn't send you a Christmas card either for that, do they? But it takes a good 3 to 6 months for this condition to get better?
It can. It's a gradual increase to where, as patients will see in the office, if we do combine treatments such as proper shoe inserts, anti-inflammatories with possible cortisone injection, night splints, you usually get significant improvement within the first month or so, but it still lingers and you have to keep up the treatment. A lot of problems that patients have is they start feeling better, so they stop doing some of the treatments that we recommend, and then you see them 2 months later, and all of a sudden the pain's starting to gradually come back. It is something you have to stay on top of.
And the reason why it takes a long time is because this tissue does not have a great blood flow. And so it stretches, it gets injured, we splint it in a stretched out position so it doesn't contract. Because the hallmark of it is your first steps in the morning are very painful. You walk like a newborn deer getting out of bed. And so you stretch out this ligament that has healed in a contracted way. Your first step stretches it, re-rips it perhaps, and you start this futile cycle of constantly re-injuring it. So if you sleep with the splint on and you take the anti-inflammatories compliantly, you could avoid surgery.
Yes.